Hi, I'm Miss Pillows, here for you and your tatas. Today we're going to tackle the 3 nursing nightmares: engorgement, nip cracking, and mastitis. My fave. Because nursing is beautiful, right guys? Especially because you have to do it every time you take a breath. But it's fine, I'm fine. Let's find out how we can get through it together. Do you know what mastitis is?
No. The milk things become infected.
If I were to tell you that mastitis is when your breasts get infected, would you run away screaming? Mastitis.
Okay.
Do you like that word? I hate that word too. What is mastitis?
Mastitis is an inflammation infection of the breast tissue. If you think you have mastitis, you are going to see things like red streaks on your breast, like hot red streaks.
Streaks like
literal,
like somebody slapped?
Yeah, it can look like a big red slap. It can have patches of redness. It can have real, literal, like streaks on your boob. You may have fever.
Hurts?
It hurts. You feel like aches and chills. It often is coming first from a plugged duct situation. So there may be like a really acute pain in one spot, or it can be a bigger lump where there's just soreness all over the boob. So the fix for mastitis is rest, possibly antibiotics, of course, fluids, taking care of yourself, because sometimes we're running ourselves ragged. But we also need to drain that breast every 2 hours. Sometimes we freak out. We go, oh my God, I have mastitis, I have an infection, I'm not breastfeeding. That would make it worse. And if you can't deal with breastfeeding, it hurts too much, then you're gonna wanna pump your breast with a manual breast pump or a hand expression.
What is breast engorgement?
When your breasts swell up, right?
Engorgement? I don't know, swelling maybe?
You're very young, just so you know. It might happen if you have children one day.
Okay.
Do you know what engorgement is?
It's when you massage the boob area, the nipples, and they get excited.
Engorgement is when the milk comes in and we fill up with milk and our boobs grow maybe another size or 2. Engorgement happens most commonly when we're not removing our milk enough. The rule of thumb for breastfeeding is feed the baby when it's hungry. Just anytime the baby shows a sign of hunger, you want to breastfeed.
You can't breastfeed too much.
You can't breastfeed too much, especially in the early days while you're building your milk supply. Sometimes though, our body just goes, hey, you had the baby, you're stimulating me, overproduce. And so we fill up a little too much. So that typically lasts for, 3 to 7 days-ish. And we just really want to try and get that baby latched on as frequently as possible to move through that and help drain the breast.
What about cabbage leaves? Is that real?
Cabbage leaves are real. Cabbage leaves to relieve engorgement are a well-known little hack. And you stick them in your bra. Now, they can actually cause you to have a little too much drying up of your milk. So we only really want to use these if I'm in extreme engorgement mode.
Did you know that nipples can get cracked?
I do. That usually happens during breastfeeding, right? Oh, that sounds painful.
Does it hurt a little bit in your soul?
Yeah.
Do you know that nipples can get cracked during breastfeeding?
No, I didn't know that. I've learned 2 things today.
Did yours?
Yes.
I'm so sorry. What is that terrible thing called nipple cracking?
Oh, the worst, right? Angry,
Very vicious.
cracking
Yes.
nipple. No good. So nipple cracking happens when the baby does not have an ideal latch. And we don't call it nipple feeding, we call it breastfeeding. So like I can make a nipple here, does that work, right? And
That's a hot nipple.
Is that a hot nipple? Like it? So like if the baby's mouth is going like chink on the nipple, then it's smushing and smashing the nipple. What it's supposed to do is actually get all of this breast tissue. So that nipple is going back to the soft palate and never getting brushed or squeezed. As soon as we adjust the latch, it's amazing because it doesn't put pressure on the nipple anymore and the nipple stops cracking.
What can you put on your nipples for temporary relief while you're waiting for a lactation consultant?
So there's a couple things. Coconut oil is often, extra virgin coconut oil. A lanolin cream, which different brands make, can be really helpful. And you want to put it on right after you breastfeed to give you that soothing. And it is food grade. It is okay if the baby does get it. If you have really painful cracked nipples, another thing that's super helpful is a warm saline soak. So you literally get some, get a bowl. It depends how big your boobs are. It could be a shot glass. It could be a bowl. Warm water, some salt, a nice saline solution. Go in here, dry them off, air dry. That can really help.
Stand in front of a fan.
Right?
Do you know if you were breastfed?
It's kind of a weird question to ask mom.
Hey, Ma, did I eat from your boob?
No, I wouldn't phrase it like that.
Is anything about this positive?
You get to bond with your kid. It's a kind of special feeling.
It's a beautiful sacrifice.
It is a beautiful sacrifice, but it's a sacrifice.
When you're feeling the pains and cracks, take care of your pair. If you think that something's not right, go get help for your hooters. Here's to letting that leche flow with a little less tears. I miss pillows. Ta-tas for now.